tonight we're going to learn a little bit about women's health, and not just mental health or spiritual health, but physical health. And so without further ado, Dr. Crowder, if you would take it away.
All right. Good evening, everyone. Thank you so much for joining me. So as she said, I'm Dr. Sakeitha Crowder. I am with Novant Health. I'm here at Winston-Salem Healthcare. Actually, I'm in my office right now presenting. I am also the medical director of Novant Health's Diabetes and Nutrition Centers. So I will begin sharing my screen. Give me a minute here. All right. And someone give me a little bit of feedback. Make sure you can see it. And give me a second to put it in the slideshow presentation mode. All right, is everybody there? We're good? Excellent. Okay, so for tonight, we're going to talk about preventive health as a foundational stone for women's empowerment. So I actually looked through the list of other speakers, and I mean, we have a lot of awesome talks that have already gone forth and a few more to come. But one of the key things is your own health. So of course, to be a phenomenal woman, you actually have to make sure that your health is in check, and don't forget about yourself. All right, so let us go to the next one. Next slide here. Bear with me. All right. So what are our objectives for tonight? There are several, but believe me, it'll go a little quicker than you think. So number one is to understand the importance of preventive health as a vital component of overall well-being. The key thing that I'll do here tonight is focus on a few of the U.S. Preventive Service Task Force, that's what USPSTF stands for, grade A and B recommendations for women. Hopefully, I will engage participants to manage the ABCs of diabetes, if you have diabetes, to prevent associated complications or further complications. And that's A for A1C, B for blood pressure, C for cholesterol levels, and S for stop smoking. We will incorporate weight management and medical nutrition therapy for numerous health benefits. Appreciate the role physical activity and exercise plays in health risk reductions. Review emotional well-being as an important part of self-care. Understand caregiver stress and adopting healthy behaviors. And lastly, seize the benefits of adequate sleep. All right, so let's start this thing. I call it a Rolodex. So we're basically going to just roll through a lot of different recommendations and kind of talk about a few of them. So we'll start with this aspirin debate. When I was in medical school and even through residency and fellowship, basically at that time, we told everyone age 40 and above, from 40 to 80 years old, to take a baby aspirin a day. Well, a few years ago, that recommendation stopped. And we made this change. So now we recommend that we initiate a baby aspirin, as people call it, which is an 81 milligram, hopefully enteric-coated aspirin, for primary prevention of cardiovascular disease and colorectal cancer. So I'll stop right there. Did I say colorectal cancer? Yes, I did. So actually, we know about, a lot of people are aware of taking a aspirin for prevention of stroke and heart attacks and blocked arteries, but the research has also shown that it also reduces your chance for colorectal cancer. All right. What is the difference? Why did I highlight primary prevention? Primary means it hasn't occurred yet. Okay, as opposed to someone who has already suffered a myocardial infarction or a stroke or has already had colon cancer. There's a big difference. We call that secondary prevention. So this is a person who is trying to prevent an event from occurring. We recommend it from the ages of 50 to 59. That's a big difference. Like I said, it was before 40 to 80, and now we've narrowed that time period down to just basically those 10 years. So who else do we recommend in this aspirin? Who to receive aspirin 81 milligrams as just an everyday therapy? Those who have a 10% risk, 10% or greater risk of having an ASCVD event. So ASCVD basically stands for, I describe it as heart attack, stroke, blocked artery. Some type of cardiovascular event in the next 10 years. Well, how do you know where you stand on that? That's going to your primary care provider. So your primary care provider can use a calculator. We call them medical calculators. They can actually take your age, gender, ethnicity, They use cholesterol numbers, blood pressure readings, and if you're already taking aspirin or not, and they can tell you what your 10-year risk for having an event is. Okay, so this is one of the newer things that we use for the last few years for cholesterol assessment. So if by chance your provider says that your 10-year ASCVD risk is greater than 10, then you should be a candidate for aspirin if you fall within that age of 50 to 59. All right, what else? People who have a life expectancy of greater than 10 years, of course, people who don't have a contraindication to bleeding risk, and those who are willing to take it. All right, so that's kind of where we stand on the aspirin debate. I'll also preference this by saying some of these slides, we update things annually. So you may, in 5 years from now, we may have something completely different on aspirin, but for now, these are the recommendations. All right. Next, does anybody know who this lady is or know a little bit about her? I'll kind of open up if anybody wants to kind of say something about this lady, Miss Fanny Lou Hamer. Anybody, any takers? You can type it in if you want. So, all right, I'll tell you a little bit about her. So Miss Hamer was a very powerful lady, very vocal during the civil rights movement and also during the voting act or voting rights movement. But what most people don't know, we know her a lot because of her political stance, but a lot of people don't realize that she was a great advocate in the community of Mississippi. So she actually did a lot of different programs and initiated a lot of programs for economic opportunities for African Americans. So for one of those was the Freedom Farm Cooperative. And in this cooperative, what she did is she actually had different people pull together finances in order to buy land for African Americans in the Mississippi area. And this allowed them to be able to own and farm collectively as a group. She also was very instrumental in gathering funds to purchase 640 acres of land. On this land, she had a co-op store, a boutique, and there was a sewing enterprise. She also was very instrumental in building over 200 units of low-income housing that were built there in this one town of Ruralville, Mississippi. So kind of actually ties in quite nicely with the Habitat for Humanity. So she built homes. That was kind of one of her goals. She showed that there was a need in the community and a lot of the African Americans did not have a proper place to live. So the unfortunate thing is that Miss Hamer actually died at age 59 from breast cancer. All right, so that takes us to our next topic of breast cancer screening. So when should we begin breast cancer screening? So the U.S. Preventive Services Task Force recommends that we begin biennial, which is every 2 years, breast cancer screening by mammography starting from age 50 to 74. Well, wait a minute, Dr. Crowder, what about age 40? I've heard that you started age 40. You are correct. So what happens in medicine is there are so many different societies that weigh in on different decisions. So most societies say that we start at age 40. And we go from 40 to age 75. What else can I tell you? Well, does that exclude persons that are age 80 and above? No, it does not. What happens is after you turn 75, it becomes an individual decision between the person and their primary care provider. So there's a lot of factors that go into place. So when I have patients that are age 80, I say, hey, you know, what do you want to do? We can continue with your routine annual screening mammography, or if you'd like, we can do every 2 years. And we just talk about the pros and the cons. And so we're not by any means saying that it stops at age 75. What we're saying is the recommendations just basically says it's on an individual basis. All right. What else? What about high-risk populations? So we all probably know there are some people that have a very high family history for breast cancer. And I'll start right here and kind of say that the family history is a key component to preventive health. So many times when patients come into the clinic, oftentimes they kind of give you this strange look, like, why are you asking me about my mom's history? Why are you asking me about my dad and all my other family members? Well, the reason why we ask for this vital information is because it helps us to risk stratify your risk, your personal individual risk for different things. It also helps to guide us. So we basically, if a person has a very high family history for breast cancer at an early age, we know that we actually should begin mammography screening a lot sooner in that person, as opposed to just going by the recommendations. The recommendations are just that, recommendations. Okay, so it is very important that you know, or try to obtain a little bit of history, you know, kind of talk to your family members, try to figure out, you know, if Aunt Susie passed away at age 30, well, why? You know, what happened, if you can. Sometimes you may not be able to get that information, but if possible, try to figure out the details. Okay. So what about the people who have a high family history, a high risk, I should say, for breast cancer? So who are those people? So here, the recommendation says we should screen for any person or family, persons who have a personal history or a family history of breast cancer, ovarian cancer, diseases of the fallopian tubes, or peritoneal cancer, or who have what we call the BRCA1, BRCA or BRCA1 and 2 gene mutation. So if we find that a person fits in that category, you should actually, first of all, discuss it with your primary care provider or your gynecologist, whoever it is that you're seeing. And then you start saying, you know, the next step is to decide if it's appropriate to do genetic counseling. And then from genetic counseling, you proceed to genetic testing if it's appropriate. Now, there's a new recommendation here, and actually I was kind of pleasantly surprised to see it, that came out in September of 2019. And the U.S. Preventive Task Force is actually recommending that women who are at an increased risk for breast cancer, that they actually should begin what we call risk-reducing medications. That's tamoxifen, raloxifene, or aromatase inhibitors for those as early as age 35 or older. Okay, so that's a big change. And why am I saying that? Because a lot of times there were people that we knew were at risk, but we really didn't have any guidance of what to do. You know, so yeah, we know that there's a problem or there's a risk, but we didn't know the next step or the intervention. So actually there are new recommendations that says those patients should actually be considered for early therapy. So once again, this is all individualized. I'm just kind of putting it out there so that you're aware, so that maybe the next time that you see your primary care provider, or if you're in discussion with your family and your friends, you can kind of make, you know, recommendations and say, hey, you know, you need to talk to your provider about this. All right. Next slide. So since we're talking about the breast, we're also going to breastfeeding. And this is a quick slide. Basically, the U.S. Preventive Services Task Force also recommends breastfeeding. So believe it or not. So there are a lot of different services available in the different communities, of course, also in the clinics, to teach mothers about breastfeeding during pregnancy and, of course, at the time of delivery and also afterwards. All right. Next. So this slide, there's a lot going on here. So what are we looking at? So on the left-hand side, I guess that's the left-hand side, you're looking at what we call the HeLa cells, okay? So these are HeLa cells. So where did the HeLa cells come from? Well, they actually came from Miss Henrietta Lacks. And I'll give you kind of the brief. Anybody, if they want to kind of chime in, you can. On this, I'll give you a little quick history real quick about Henrietta Lacks. So Henrietta Lacks was born in Virginia. She lived from 1920 to 1951, I believe. So she lived 31 years. Unfortunately, she died, and I said 31. So she died at the age of 31 from aggressive cervical cancer. Her cells, when she went to Johns Hopkins, so the family had moved to Baltimore, Maryland. When they moved and went to Johns Hopkins University and did the biopsy, they found the cancer cells. And the cells grew so rapidly that they actually sort of held on to the cells. And later obtained more cells, and these cells were just phenomenal. So Miss Henrietta Lacks cells became the first successful clone human cells in 1955. From her cells, research, a multitude of medical research has occurred. The polio vaccine was developed using the Henrietta Lacks cells, or the HeLa cells. Cancer research, AIDS research, the effects of radiation, toxic substance on human cells, gene mapping. I mean, just a ton. In fact, there are 11,000 patents out there using the HeLa cells. What did I say? Well, if you look here at this book that's written, the sad part about it is Miss Henrietta didn't give permission. She didn't know that this was going to happen. And her family weren't aware for several years. I think it was in the 70s when they became aware of what had occurred. Of course, and they did not, share part in any of the profit that occurred. So it's kind of one of those unfortunate things. But at the same time, because of Miss Henrietta's sales, medicine as a whole has progressed so much. So let's take a look at what happened to her. She died at age 31. That was very early, and it was from cervical cancer. So cervical cancer screening. What are the guidelines? So guidelines at this time say that we should begin screening at age 21, and we should continue to age 65. So how do we screen? We screen by a Pap smear every 3 years, starting for women age 21 to 29 years of age. For those that are older, from between age 30 and 65, the guidelines now, and I said now, the guidelines are now recommending a Pap smear every 3 years, or every 5 years, you can have what we call a high-risk HPV testing, or you can have the combination of the two every 5 years. All right. So what I listed here, what you see in the image, this is actually the image of a cervix. Here, so you see the normal, this is what it looks like, a speculum. So by the way, the cervix is the bottom or the lower portion of the uterus. All right. So what you see is people call it the wound or the uterus. That's what the uterus is the wound. So the very bottom part is the cervix. So when you have a Pap smear, this is kind of what the gynecologist or the primary care provider sees. And then they look for any abnormalities there. And those kind of abnormalities, we do a Pap smear, which is cytology, so that we can get a few cells and determine if there are any cancer cells there. All right. So these are some of the recommendations. Next, what else about cervical cancer screening? Don't forget about the postpartum Pap smears. So gynecologists, they have a whole schedule of when you should get a Pap smear after you have delivered a child. It is very important. So back to the Henrietta Lack story. So Miss Lack had her last child and she passed away from cervical cancer when the child was less than 2 years old. So what happens, we're kind of aware that what can happen is you can have some cells that are what we call atypical cells, but after having a child, sometimes those cells can just explosively grow. And so this is why it's so important for women not to feel like, okay, I've just delivered a child, I don't need to see a gynecologist again. The answer is no, that's not the right thing. You must go back and follow up with the gynecologist. If they say follow up in two months and then again in 6 months, it is very important that you follow up, because we do know that sometimes, unfortunately, those cells can proliferate very quickly after giving birth. So this is exactly what happened with Miss Henrietta Lack. Okay. What about, I'll kind of talk a little here. There's this thing, some of you may be aware and some of you may not be aware of it. We call it the HPV vaccine. We administer these now starting for teens. I think it starts at 12. I may be wrong on that, so don't quote me, but I believe it's 12 years of age and up, and it goes all the way up to age 26. And it's males and females, because of course, if the HPV virus, the high risk, virus is spread, well, it does no good just to immunize the females and not immunize the males as well. So this is our new effort to be able to reduce the spread or prevent cervical cancer. This was not available, many years ago. So 20 years ago, it wasn't something that we were doing. So this is something new and improved. This is showing how we're trying to prevent early death from cervical cancer, like what happened with Miss Lack. So we've made a lot of improvements over time. All right, we'll switch gears a little bit. We're still in the same area. So what is BV? BV is bacterial vaginosis. It is the most common vaginal condition in females aged 15 to 44 years of age. So in the US, you see the stats here, an estimated 21.2 million women aged 14 to 49 have BV. Oftentimes it is asymptomatic. Sometimes ladies do have a little bit of discharge or a little odd odor, and they go and see their gynecologist for it. So why am I bringing this up? Because having bacterial vaginosis actually increases a woman's risk for having sexually transmitted infections, such as HIV. So it is very important that we recognize BV kind of as a little stepping stone to other complications that can occur. So if we can treat it early, it'll reduce those risks. So although bacterial vaginosis can occur in any woman, sexually active or not, it is more commonly in sexually active females. Okay, so if you want more information, you can go to the CDC's website. All right, STD, formerly STD, it is now called sexually transmitted infections, screening. So this is kind of a big slide here. It kind of covers I sort of highlighted the key things. Chlamydia and gonorrhea screening occurs in sexually active females from age 24 years and younger, all right, or those who are at an increased risk. Hepatitis B virus occurs in adolescents and adults only if they're at an increased risk, but it occurs in all pregnant females within their first trimester or their first prenatal visit. Syphilis, once again, we screen all pregnant females for this, and then we screen people at an increased risk. HIV, they recommend screening for adolescents beginning at age 15 up to 65, and then of course those at an increased risk. Now, why did I bring out the STI screening? Because oftentimes I have a lot of patients who come in and they feel like if they got a Pap smear, they were automatically screened for everything. That is not the case. All right. In some cases it may occur, but not all the time. So we do screen, of course, age by the age criteria here for chlamydia and gonorrhea. But a lot of the other things, if you feel that you're at risk or you're having concerns, this is one of those you need to be honest and just kind of talk to your provider about it. Okay. I have a lot of females, they'll just come in and say, hey, give me the works, give me, full screening, about every, 1 to 2 years, or if they're with a new partner or, some infidelity or something has occurred in the relationship, in the marriage or whatever relationship, they'll come in and get screening. It's okay. And we actually recommend that you do that. All right, next we're going to talk about colorectal cancer screening. And of course, we probably all know who this person is that I featured here. So when should we start screening for colorectal cancer? We should actually start at age 50, from age 50 to 75. But once again, we go back to the individualized type approach. So there are several different methods that you can use for colon cancer screening. Stool-based studies, that's what we call the fecal occult blood test or the FIT test. Cologuard fits into this, or direct visualization. So that's the good old-fashioned colonoscopy or flexible sigmoidoscopy. So family history, once again, is very important. It is crucial for colon cancer screening. So if you're in a family where there's some type of hereditary colon cancer, or if you have a condition called inflammatory bowel disease, those are things like Crohn's disease or ulcerative colitis, we recommend that you start screening much earlier. Okay, for some of those patients, that may mean a teen in their teens, like about 18 or 15, depending on the earliest relative that, was diagnosed with colon cancer. What about the ones beyond 75? Well, once again, this is one of those where it's between you and your provider. All right. So switching gears here. We're talking about falls. So fall prevention in community dwelling older adults. So what do we consider older adults? 65 and above. So one way to prevent falls, or one of the top things, is by exercise. So exercise intervention does help to prevent your fall. So what do I have here? I have a photo. We have Tai Chi, we have yoga. So those are two key things to help with balance that helps to reduce your chances for falls. So age gracefully, that's our key. Of course, my background, I didn't mention it. I am actually internal medicine certified and also geriatric medicine certified. So I care a lot about this. So age gracefully. So the CDC recommends flexible training and balance training 2 to 3 times a week for those that have chronic medical conditions. Yoga, as I mentioned, yoga and Tai Chi are included to help with flexibility, muscle strength, and balance. Switching gears again, who is Elsie Lax? Who is Elsie Lax? Well, I'll tell you who she is. So she's actually the second child of Miss Henrietta and David Lax. She unfortunately was born with developmental delays. At that time, they used to call it different. Okay. They also called it deaf and dumb. So unfortunately, Miss Elsie died at age 15 at an institute. So during that time period, there are a lot of things that we kind of take for granted now that we have in place, and people don't really understand why is it that you take prenatal vitamins. Well, here's why. Folic acid for the prevention of neural tube defects. All right. So the U.S. Preventive Task Force recommends that all ladies who are planning or capable of pregnancy, so if you're menstruating age, to take a total of a supplement containing at least 0.4 to 0.8 milligrams, or that's 400 to 800 milligrams of folic acid. So what happens for women who are folic acid deficient and they are pregnant? Well, what can occur to the child is a low birth weight, neural tube defects. So here in the photo, I have the spina bifida and anencephaly, developmental delays and seizures. So it is possible that Miss Elsie Lax had the developmental delay that occurred it may have been all due to folic acid deficiency. So that's why it's so important to make sure that women go and see their obstetrician as soon as possible, as soon as they determine that they're pregnant, so that we can make sure to have you on the right vitamins. All right, so this is switching, we're changing gears just a bit here. This is Sedona, Arizona. Very beautiful place, very serene. I just actually had the opportunity to attend a conference just before coronavirus began. So it was in February that was out here in Arizona. It's beautiful. Tobacco cessation. I mentioned that we talk about tobacco. So if you are pregnant, we are now, or for any adults. So if you come in for your CPE visits, a lot of times we'll ask a ton of questions, and this is why. This is all part of our prevention. So we ask about smoking. When should we screen? Basically during your annual visits, because there's a lot of information that we can give you and that we can help with tobacco cessation. So of course there's counseling. There are counseling programs that are available. There are support groups, and we have medications also to help. So of course a lot of people are aware of Chantix as being a medication to help with tobacco cessation. There's also Zyban, which is Wellbutrin, or another name is bupropion. There's the Nicoderm patch that you can put on. There's a Nicorette gum, lozenges. There's a ton of things to help people. So what we're asking is, if you are a smoker, talk to your primary care provider about it. And the reason why is because we realize that people who either smoke or consistently exposed to secondhand smoke have a higher risk of cardiovascular disease, premature death, microvascular complications, and if they have diabetes, they also have poor glycemic control. And then the last part that I'll mention is, oftentimes I have patients that say, well, if I quit smoking, then I'll gain like 10 pounds. And so if I gain 10 pounds, doesn't that negate the improvement of that I gained when I quit smoking? Well, the answer is actually, even the 10 pounds, even if you gain weight temporarily, it does not diminish the cardiovascular benefits that you receive from tobacco cessation. Okay. So use that next time someone says they don't want to gain weight. It's all right. You can get the weight off later, but you actually have to try to protect your heart and your vessels as best as possible. All right. What about lung cancer screening? So currently, lung cancer screening should occur with a low-dose CT scan beginning at age 50 to age 80 for those persons who have a 20-year pack year history of smoking. So what is that? That's when a person smokes, say, 1 pack a day for 20 years. Or a half a pack a day for 40 years. So when you calculate it, or we added up, the medical calculator adds that as 20 pack years, okay? Or who currently smoke or have quit within 15 years. So after you have gone beyond that 15-year mark of your tobacco cessation, you can either decide to continue with the CT scans, or you can, go ahead and discontinue it. All right. So these are new. As you see, I put the onset. This recommendation was made this month. This month. It was a recent. So I'm giving you the most up-to-date information that I can. All right. So this is a transitional slide. This is the Columbia Gorge. This is in Portland, Oregon. So the image on the left-hand side, it has this stone and it says this is the Portland Women's Forum. So actually women are the reason why they actually preserve this whole area. It's very beautiful. It's one of those, you just have to see it in person and just kind of stand over the gorge and look. It's amazing. But there were women. So this is a team of women who said, hey, we've got to do something to preserve the beauty of the Columbia River Gorge. So once again, showing women empowerment and making a change in society. All right, osteoporosis. I'm going to kind of go through this kind of quickly. Osteoporosis, this is the DEXA scan. We recommend it for prevention of osteoporotic fractures and postmenopausal women who are younger than age 65 who may be at an increased risk. So once again, this is one of those, we discuss it with each individual patient, but it's on the list of things to do. High blood pressure screening should occur starting at age 18 years or older. All right. In addition, I'll also add that the recommendations say that you should obtain your blood pressure in some type of a clinical setting outside of the office. So where is this? Pre-COVID, you could get your blood pressure checked at the machine in the pharmacies. Can't do that now, but of course, pre-COVID, you could. So everyone should know what your baseline blood pressure is. You should buy an electronic or a home sphygmomanometer. You should try to check your blood pressure weekly. And it's a good idea if you have hypertension to bring that log of all the blood pressure readings to your primary care visits, and also maybe once a year bring the device. So I have a lot of times where patients will say, my blood pressure is great at home, and in the office, it's 160 over 110. Well, of course, in the office, we're seeing a completely different number than what they're seeing at home. If you bring your device in for validation annually, then that helps your clinician to know that, okay, yeah, this is white coat hypertension and it's okay. All right. What else? This is a slide talking about weight. I'm actually going to get into weight management and talking about that in a few minutes. So the recommendation is for anyone who has a BMI, body mass index, of 30 or higher, that they should be encouraged to get into some type of what we call a multi-component behavioral intervention. So that's a referral to a bariatric center, a nutrition counseling like registered dietitian, lifestyle modifications. Here at Novant, we are connected with this entity called Core Life. All right. What about diabetes and pre-diabetes screening? They recommend that anyone age 40 to 70 years of age who falls into the overweight category, that's a BMI of 25.9 to 29.9, or the obesity category, which is 30 or higher. We recommend that everyone should be screened for diabetes. So that's an A1C or either a fasting glucose, whichever your provider decides. You should have some type of screening for diabetes. All right. So let's look a little bit more into diabetes. As I said, we'll learn about the ABCs of diabetes, and that's the combined diabetes care goal. A1C should be less than 8. Of course, most of the time we actually want you under 7, but at least under 8. Blood pressure should be less than 140 over 90. Cholesterol for your non-high density, low protein, it should be lipoprotein rather, should be less than 130. And of course, we talked about tobacco cessation. The CDC says that in the year of 2017 to 18, only 26% of the US population met all 4 goals. So of course, obviously we have a lot to do for prevention. So that's why I brought it into this talk. So what are the benefits of achieving all 4 of the diabetes goals? Well, number 1, you can reduce your risk for ASCVD, which I told you earlier is atherosclerotic cardiovascular disease. You can also reduce your chances for heart failure. You can also reduce microvascular complications. So that's what we call retinopathy. You've heard of people say they have vision problems because of diabetes. That's retinopathy. Neuropathy, that's the pain, the numbness, the tingling in the bottom of the feet, also can occur in the hands or fingertips. And nephropathy, so that's kidney disease that's related to diabetes. It also reduces the risk for cardiovascular death and diabetic deaths. So why is it so important to lower your A1C? Well, I've listed it right here. So if you can lower your A1C by at least 1 percentage point, you will actually reduce your risk for complications by at least 21%. So what am I saying? You can reduce your diabetes-related death by greater than 21%. MI, which is old-fashioned heart attack, as people say. Myocardial infarction by 14%, greater than, by the way. Microvascular disease, that's the eye and the kidneys and the neuropathy, by at least 37%. This is just 1 point. This is just 1 point. Stroke by 14%, peripheral vascular disease by 43%, heart failure 16%, and even cataracts by 19%. And that's just by lowering your A1C by 1 point, okay? Blood pressure. What else can I tell you about it? On the slide before I said greater or less than 140 over 90. Well, there was a study that came out a few years ago that even proved that you can get it a little lower. Systolic blood pressure less than 120 over 80, you'll actually reduce your chances for stroke. Okay, so people always say, what can I do to get my blood pressure down naturally? That's the whole thing. What can I do myself? And this is why I'm empowering you with this information. Number one, we've got the DASH diet. Number two, weight loss, physical activity or exercise, and then try to bring your alcohol consumption down. So studies have shown that if you bring your alcohol consumption down to less than 1 to 2 drinks per day, you'll reduce your blood pressure by 2 to 4 percentage points. Okay. The DASH diet, I'm not really going to go through this in detail because there's a lot of online resources that you can find for the DASH diet. But in short, the first 2 things on this list you see are very high. 4 to 5 servings of vegetables a day, 4 to 5 servings of fruit a day. So that's a lot. That's a big change. And then if you look at the very bottom, 5 servings of snacks or sweets per week. I didn't say per day, I said per week. So there's a lot that you can change in your diet to bring your blood pressure down. More about the DASH diet. So the typical American diet, most people eat about 4,000 milligrams of sodium a day, sodium, i.e. salt. If you're trying to lower your blood pressure, if you can get it down to about 1,500, somewhere between 1,500 to 2,300, you'll actually reduce your chances. You'll reduce your blood pressure down significantly. All right. So a lot of people say, well, I eat okay. You know, I eat well, Dr. Crowder, I'm fine. Well, sometimes there's hidden salt. All right. So where are these hidden salts? These hidden salts are found in processed foods. Okay. So anything that's quick, that you can just like throw it in the microwave and heat it up in a little bit, like soup. Believe it or not, soup has a lot of salt. So it's in a can. If you look at the expiration date, I mean, the soups actually can last for like 2 or 3 years. And I mean, think about how is that possible? Well, it's the salt. So they actually add salt to preserve the food. So things like soup, instant foods, lunch meat, so sandwich meat, as we say, has a lot of salt in it. Canned vegetables, processed meats. So as you see here, I've put like fresh, these are fresh meals, these are fresh foods. Of course, it's a lot healthier for you and it has a lot less salt. So if you're trying to make a change, you can make a change by the type of foods that you pick up when you go to the grocery store. So instead of picking up the canned meat, the lunch meat, and all those things that are quick, it might take a little more time. We call it meal prepping, but it's the health benefits are just phenomenal. So if you're trying to come off blood pressure medications or you're trying to use less blood pressure medication, this is it. Okay, so you've got to help us. I mean, as clinicians, we don't see it as it's just us making the decisions. It's a shared approach. And so in order for us to make this team work, you know, you got to make some modifications as well. All right. What else? Hypertension. So weight loss. I like this. So for every 5 pounds that you lose, you can anticipate about a 2.5 drop in your systolic blood pressure. Systolic blood pressure is the top blood pressure. So if you lose 10 pounds, well, that's 5 pounds for your systolic blood pressure. If you lose 20 pounds, well, that's 10. So this is how, you know, weight management ties into hypertension very nicely. What else can I tell you about hypertension management? Well, we recommend physical activity or exercise. At least 30 minutes a day of brisk walking or some other type of aerobic type of activity can trim off about 4 to, we'll just say 5 to 10 points off of your systolic blood pressure just by exercise alone, regardless of weight loss. All right. So if you're looking for more information, especially about cholesterol, I'm going to kind of breeze through that. You can actually go to the American Heart Association. I listed it here, www.heart.org. You can find all you want about nutrition and heart management. So hypertension, the DASH diet, cholesterol, ways to bring your cholesterol down. I mean, it's all listed there. Next, this is a slide. I had the pleasure of going to Israel 3 years ago, I believe now, and this is Masada. So Masada, as you see, this is very high. And why am I showing you this slide? Well, because if you look right here in the corner, there are stairs. You see the sky lift in the middle, way down in the center. Yeah, I'm sorry, I can't find my pointer. Maybe I can find it. My pointer here, but right in the middle here, there's the sky lift, and then there's the stairs right in the corner. Well, one way that we can help ourselves is to make a lot of lifestyle modifications. So even on vacation, you can incorporate exercise. So that's the whole point. You can incorporate exercise in everything you do. So what am I talking about? Physical activity. That's all movement that increases your energy use. Whereas exercise, there is a difference. Exercise is planned, structured physical activity. All right. So exercise improves your blood glucose for those patients or people who have diabetes. It reduces cardiovascular risk factors. It contributes to weight loss. It improves your muscle strength, and it improves your overall well-being. So what do I have here? As you see in the picture, this is what we call an under the desk elliptical. So there's all sorts of ways, and there's all type of new things that are available to help you with physical activity. So even if you're working, you can still exercise. What else? Physical activity, your goal is to achieve 150 minutes of exercise or physical activity, moderate intensity physical activity a week. Now, I know that sounds pretty daunting at one point, but you shouldn't think of it as the whole picture. Think of it as the individual components. So that's 30 minutes, 5 times a week. You can break it down even smaller than that. Now, what I tell my patients is, I didn't say you have to run a marathon. I'll say it again. I did not say you have to run a marathon. I didn't say you have to become a triathlete. That's not what I'm saying. You start small. So if you're doing nothing at all, if you haven't started any type of routine, no type of physical activity or exercise, start with 5 minutes. Make it real simple for yourself. You can make it where you just walk up and down the main hallway in your house. Something real easy, 5 minutes, you start there. When that becomes comfortable, you increase the time to 10. When that becomes very comfortable, you go outside and you might walk around the house, all right? And then when that becomes, then you can start widening out what I call your span. So you start with 5 minutes, 10 minutes, and before you know it, you're able to walk the whole entire neighborhood, okay? So small steps. You start with small goals and you can achieve the bigger goal. What else do they want us to do? They said 2 to 3 times a week, you should work on all major muscle groups. That's your legs, your hips, your back, abdomen, chest, shoulders, arms. And what are examples here? Well, I showed you one, dancing. I think this is one that's kind of underrated. We forget about dancing. We do that when we're younger, but as you get older, sometimes you forget that it is exercise. So you can dance in your house. There's a video that I love. It has an older lady and she's dancing while she's cooking. I love that video because that's actually what you should do. You can dance while cooking. You can walk briskly. Housework. Yes, ladies, housework counts as physical activity. Mowing the yard, your flower garden outside, swimming, bicycling, playing sports. So what else? Physical activity, you should engage in 2 to 3 times or 2 to 3 sessions a week of resistance exercise. So that's the weights or the bands, okay? What else? Physical activity. Well, I'm trying to show you all the ways that you can achieve it in a very easy manner. So right here, we have this new thing called Deskercise. All right, what is this? This is teaching you that you can, even as we are working from home and working in our work environments, you can still get physical activity in during the daytime. All right, so there's this mini bike pedaler I'm looking at the left-hand bottom of the screen. There's the elliptical that I showed you. There's also a treadmill, believe it or not, that fits under the desk. There's a leg swing and a stepper. Here, what else can you do? Well, you can make some modifications. If you're working from home, they do have stand-up desk. So we're recommending that every 30 minutes you try to stand up. So if you're sitting like I am at a desk, every 30 minutes you should try to pull back, stand up, stretch, do something to break the sedentary style habit that you're in. So you have the desk, you stand up. We have the lady here with the peddler on the floor. You can utilize that, but I love the peddler because you can actually put it on the table and you can actually exercise your arms at the same time. So once again, small goals. Don't look at it as 150 minutes of exercise a week. Look at it as you start off with 5 minutes and you build. All right. I told you we talk a little bit about your emotional well-being. So depression screening. Don't get upset during your physical exam if we ask you depression screening questions. We actually ask everyone these questions because we're trying to make sure that we don't overlook struggles that people may be going through. So the U.S. Preventive Task Force recommends that we screen everyone, all adults, including pregnant and postpartum females. Why? After screening has occurred, we have to come up with an accurate diagnosis, and then we can begin looking at effective treatments and appropriate follow-up. Ask, and I mention this a lot because I think in the minority communities, a lot of times there's a stigma around mental health issues, and we don't want to talk about it. It's one of those things that oftentimes we want to just kind of sweep it under the rug and act like it doesn't exist, but it does. So here in the image, you see this lady, she has a baby. So obviously she looks like she's probably going through postpartum depression, or a lot of people call it postpartum blues. It is real. It does exist, and we know it's there. So if you find yourself in this situation, you should, of course, seek medical attention, seek help. Support groups. There are a lot of support groups out there. So new moms, there's a lot that you go through. There's a lot of transition. The babies aren't really sleeping. Your sleep is disturbed. You're not getting proper rest, and you're trying to make sure you're doing the right thing, and it becomes overwhelming at times. Well, there are support groups that exist. Sometimes if we need it, we'll recommend medications. So we are actually trying to make sure that we as a medical community focus a lot on pregnancy and the postpartum period for females, because we know that depression is quite common during those times. Okay. What about women as caregivers? The CDC says 2 out of every 3 caregivers in the United States are females, women. I think most of us kind of can relate to that. Women who are caregivers are at an increased risk for poor physical and mental health, including depression and anxiety. Ways to reduce your risk for complications includes maintaining healthy behaviors, managing your stress, and seeking extra support. So oftentimes I have a lot of females that'll come into the clinic, and I can tell that they're under a lot of stress, and it's because they're a caregiver for a mom or father, or maybe a spouse, or maybe even they have a child that has a disability. And over time, it can wear on you, and it can become pretty stressful. But a lot of times people are embarrassed to seek help because they feel like it's my obligation. And I don't want to make the person feel like they're a burden to me, but yet they internalize a lot of the stress that they're feeling. So in that case, what do we do? Number 1, regular exercise. Sometimes just going out and taking a walk, fresh air can do a lot for you. It just helps to clear your mind. Practicing good sleep habits and avoiding excessive alcohol. I actually had a lady who, unfortunately, she did become an alcoholic because her husband had gotten into a tragic car accident and was left paralyzed. And during the process of coping, she turned to alcohol, and before she knew it, she became an alcoholic. And then later, of course, we had to sort of deal with that situation. She's fine now, but that's how it happened. She never meant to become an alcoholic. It was because of the caregiver burden that she was facing. So what are some other things? In the community, you should actually look at, there's this thing called Respite Care that we offer. It is offered through the hospice. In the different communities, the hospice centers, they offer respite care. And that's where if you have a loved one who is unable to provide or take care of themselves and needs like 24/7 care, if you need a break, say if you need to take a vacation, you can actually go to the hospice center and talk to them about respite care. And what they would do is they would admit your loved one and they would take care of them during the times that you're on vacation. Okay. All right. So there's a lot of things in the community, and I just wanted to make sure that I stress the importance of taking care of yourself when you're taking care of others. Okay. I see it happen a lot. So I can list cases after cases of women who unfortunately failed to get the cancer screening and other things because they didn't think they had time because of their caregiver responsibilities, and it actually backfired on them later. So please take care of yourself. What else? Sleep. Sleep is very important. The CDC says too little sleep makes dieting much harder. So those of you trying to lose weight, think about your sleep. It makes dieting much harder because it increases your hunger and your appetite. And if you notice, a lot of times you crave high calorie foods and high carbs. So this is true for people who work the third shift. A lot of times they just crave carbs, and it's actually their body, their body's way of trying to stay awake, but it's a spiral effect. So too little sleep can also trigger stress hormones, which tells your body to hang on to fat. So this kind of ties back into the weight management portion. Look at your sleep. What's going on? Are you sleeping appropriately? So what about obstructive sleep apnea? That's OSA. Obstructive sleep apnea increases a person's chances for cardiovascular disease, such as arrhythmias, which is palpitations or irregular heart rhythms, such as atrial fibrillation or AFib, and also heart failure. Managing obstructive sleep apnea improves your quality of life and also your blood pressure. Yes, I said blood pressure. So oftentimes when patients have an extremely high blood pressure, I will send them for a sleep study. Of course, a lot of times they do have obstructive sleep apnea. They begin using the CPAP device at night, and their blood pressure becomes much more manageable. It also helps with weight loss. So remember, we talked about the weight loss and sleep. So if you're not getting adequate or appropriate sleep, you are going to struggle with losing weight. It also, like I said here, it also helps to reduce your excessive daytime fatigue, and it helps you to improve your dietary selection. All right. So sleep and sleep apnea, very important. If you have been diagnosed with obstructive sleep apnea and they gave you a CPAP device, I recommend that you start with small increments. So, most people cannot use it and sleep throughout the entire night in the beginning. You start by using it for a couple of hours at a time until your body gets used to it. And then before you know it, you'll be able to use it effectively. All right. What else? I think we're coming to the end of my slide presentation. All right, so transitioning here, just something beautiful, nice scenery to look at. All right, so who's here? Well, of course, I work for Novant Health. So Novant Health is definitely here to help you reach your wellness goals for those of you in our footprint area. If you do not have a primary care provider and you're in the area, you can visit this website, www.novanthealth.org. There's a little tab at the top that says find a doctor. You click that button and it'll open up a whole host of different things and selections for the type of doctor that you may be looking for. All right. If by chance you have diabetes, you have pre-diabetes, or maybe you're looking for a little bit of nutritional counseling or help with a registered dietitian, if you're in the Novant footprint, you can consider using our Diabetes and Nutrition Center. Same thing, you go to the same website, www.novanthealth.org. You click on services, then you click on diabetes, and then you'll see all of our locations there. Also under this tab of services for tobacco cessation, we have counseling there. You can click on that. Basically, there's a host or a wealth of information there. Of course, like I said, I'm Novant, so I can only share Novant's information with you. I know that all the other medical facilities in this area also have things in place to help you reach your wellness goal. All right, what else? So I basically tried to give you like overview, a lot of recommendations by the U.S. Preventive Task Force. But if you want to actually go and figure out what recommendations are specific for you, you can go to this website. It's health.gov/myhealthfinder. You can actually put in like your age, your gender, ethnicity. You can put in a lot of other factors and you'll get a little printout. Well, it will give you your individual recommendations. It's actually kind of nice to do this because you can take this to your primary care provider. You can actually, I get messages through my chart from some of my patients saying, hey, should I get this screening? And I mean, what I want you to do is kind of build a collaborative effort with your PCP. And being kind of not just feeling like someone else is taking control of your health, but you're in control. It's all about you. And we kind of want to work together as a team. All right, so these are my references. There's a lot. If you want this, it'll be available later. And at this time, I'm going to open it up for question and answers. And thank you so much for participating and being with me. That is my dog. That is my dog.
Hazel Griffin, looks like you have a question.
Yes. Hello, how you doing?
Hi.
Hi. I have a question. I go to my doctor here in High Point, and she always checks, like everything you were saying, she checked for diabetes and everything. But
Yes.
my doctor in Winston-Salem, she didn't check for all of that. So Dr. Carla told me, said, like, women of color, you have to check for diabetes, cholesterol, and all that stuff. So she kind of found, I don't know, I have the paperwork. I don't know how to describe it. She said that my diabetes was stable, but they wasn't like what they supposed to be in my cholesterol. So I was eating bananas every day. I love bananas. So she told me now just take bananas, slice them in half, and just eat one and wait like a couple more days. And with my cholesterol, she told me that with my cholesterol about, I don't eat any red meat or anything.
Yes,
so I have it under control. But you was talking about the breast cancer patients. I had breast cancer in 2012, July 26, 2012. July will be a 9-year survivor. And you was talking about the tamoxifen. My doctor, Dr. Nick Kryson at the Derrick L. Davis Cancer Center, he had me on that medication. So I know all about that.
Yes,
I had my surgery, the hospital across from Forsyth Hospital. I can't think the name of the medical center. You know what I'm talking about? That's what I had my surgery. So, I don't eat any red meat, and I love veggies. I eat veggies every day. And I love fresh fruit. I don't like canned fruit and then the canned veggies. I buy the fresh veggies and stuff. But it's an interesting class and everything. Everything you was telling me about, my doctor kind of have me under control. I have thyroid problem. She said my thyroid was overactive, and I was wondering why my weight won't increase. She said because if you have overactive thyroids, you'll be at a stable weight.
That's right.
Yeah,
that's right.
So I'm doing better, but I'm taking care of myself. I go back April the 7th for my mammogram in Winston-Salem at the breast center, and then I see my oncology doctor the 28th. So I'm doing good with having my breast cancer. It was stage 0. Thank God. Mammograms are very, very important.
But see, you just brought out a point right there. You said when they found that it was stage 0.
Yes.
So this goes back to the importance of screening.
Yes.
So if screening hadn't occurred, things could have been a whole nother way. But because they found it so early, I do thank you for sharing, because they found it so early in your case. Here you are, you said 2012, right?
Yes, 2012.
Yeah. So here we are, 9 years later, and you're doing well.
Yes.
Because of the intervention that occurred way back when with screening. The other thing you mentioned, and I'm glad you brought it up, was your lifestyle. So you've made a lot of changes. You're doing well with your diet. For patients who have had cancer, any type of cancer, one of the biggest risk factors afterwards is osteoporosis. So density and vitamin D deficiency. So that plays a big part. In my clinic, my staff know that I'm going to check a vitamin D level on a lot of people. And the reason why is because vitamin D deficiency is very common after people have had any type of cancer. And like I said, vitamin D deficiency then puts you at risk for osteoporosis, and osteoporosis puts you at risk for fractures. Okay.
Right.
And so it's like a continuum. And so if we can start, my thing is prevention. Stop it from the beginning, like before it gets to this end point. And so you brought up a good point there about talking about changing your diet. The other thing I'll say is with osteoporosis prevention, exercise. We call it weight-bearing exercise. So that's anything that you're upright. So walking, jumping, anything that gravity is against you. Basically in any way, form, or fashion, it strengthens your bones. So I knew a lady who had cancer, breast cancer, and unfortunately she did have osteoporosis, pretty severe. But this lady started walking. She started with the small steps, and then before you know it, she was walking around town. She was doing miles and miles, and this lady reversed her DEXA scan score. It was amazing. So it was just exercise. So lifestyle plays a huge importance in where you're going to find yourself in the future.
Right, because I take vitamin D every day. I take
That's right.
2 of the soft gels. They are 1,000 units. I take 2. And then back to my breast cancer, when I went for to have my mammogram in May of 2012, I knew something was going on because I was there close to 4 hours. And I said, oh Lord, I got to pray. And I said, Lord, something's going on. And they told me when they found it, it looked like salt grains. You could take salt and sprinkle it on the table. That's how it looked when it had first started. Did a biopsy, and the scar have kind of healed because I used the cream and everything. Yes, and Dr. Carr from Winston-Salem, he did my surgery and everything, and I done good. But like you said, mammogram and going to the doctor and be honest with your doctor and talk to your doctor and follow your doctor's instructions is very important because females can have symptoms and they don't know it. Yes.
They can, and sometimes people have symptoms and they don't want to talk about it.
Yes, yes.
And that's another. Being African American, I can say I've seen it. I've seen some of my family members do it, and they go in the clinic and they just go quiet.
Yes.
And unless the doctor says a specific question, they say nothing. That doesn't help. You've got to communicate. You've got to be vocal. You've got to tell your doctor what's happening. So if you're a postmenopausal female and all of a sudden you start bleeding again, you start having periods again, see your doctor right away. Okay.
Right.
That's why they say Pap smears can stop at age 65. And the reason why is because, the studies have found that if a lady develops uterine cancer, after age 65, they're going to bleed. So remember I showed you that slide. And when they start with bleeding, most women are going to seek a doctor out once they've had no periods for 10 years and all of a sudden they start having blood again. Okay. So that's why. So, but you got to communicate. You've got to have that one, that dialogue. It can't just be one-sided. So be active. I'm actually hoping this presentation empowers you to be an active participant in your own health. Okay. All right. Thank you so much. Thank you.
Does anybody else have any questions? I know we learned a lot tonight, which is great. No questions? Okay. Well, Dr. Crowder, I want to thank you personally because I was able to take some notes on my own health, and I'm sure everybody else was as well.